Hi, welcome back to Wellness Wednesdays here at Spine and Rehab Specialist. I'm Earl Hayden, one of the physical therapists here, joined again by Chris McMillen. Today we're going to show you 6 different things you can do to treat sciatica. So one of the common things we'll see with sciatica, you might have difficulty either bending forward or maybe even bending backwards. So the first thing you can do is try bending forward and see how that feels. And then if you feel like you're having more of that pain going down the back of your leg, that's the direction we don't want to do. So if that's feeling painful after a few repetitions, try going backwards. So we're just leaning back, trying to push those hips forward. You're trying to go back as forward or as far back as possible. If you're not feeling the pain in the leg, that's what you want to go with, okay? If that's too much pressure, we can do that while lying down. So go ahead and lay down, Chris. So flexion and lying is just pulling both knees to the chest, and you want to make sure you get those hips curled up, and you want to do 10 or more repetitions if that feels better for you. Now the extension and lying, or the press up or cobra for all you yoga fans out there, just keeping those hips locked down and just pushing that chest up as high as you can go, trying to arch through that back. Now some people, they tend to maybe hinge around the spine, they don't get a lot of movement down here the lower parts. So the way we can do that, go ahead and relax, Chris, is you can prop your feet up against something so your knees are bent. Now go ahead and try it. That shifts the stretch to a little bit lower down on the spine. You may not be able to go up as high, but if that feels better and it really helps to control those symptoms going down the leg, then that's what you want to do. Just prop your feet up against the couch. 10 or more reps should be good. Another thing you can definitely do if you want to just reduce that tension you got on that nerve is you can use a tennis ball or a foam roll to kind of roll across that glute medius muscle, take some pressure off the sciatic nerve, as our other physical therapist Anthony Durant has shown in a very popular YouTube video we have. So you just kind of sit on top of that tennis ball, you just kind of roll across that. If you want to get a little bit more stretch, you can even cross this leg over the other one like so. That puts that muscle in a little bit more stretch. But if that's too uncomfortable, you need something a little bit more broad, you can even use a foam roll, okay? And you can still get the good effects. Maybe about 2 to 3 minutes should be good for most. The next exercise we're going to show are called nerve glides or nerve flossing. So you want to get the leg that where you're having your sciatic symptoms, you can hold that right here, and then what you're going to do, you're going to try to straighten out that leg. And once you feel a little bit of that tension or just short of that normal pain you get, then you want to start pumping the foot that pulls on that nerve, kind of get it loosened up, making sure it glides on the body. If you can't straighten out as much, then straighten out the leg as far as you can go, pump it there. If you feel it's loosening up, gradually try to straighten the leg out a little bit more, okay? Then we can also do this while sitting. So while sitting, we're going to lift up the leg with the toe pulled back and lift up the head. So we're moving the entire spinal cord with the head and the leg, okay? So we go up with the head and the foot and down with the head and also with the foot, okay? Again, 10, 20 repetitions or however many it takes to feel better should be good. One thing that tends to happen when we have sciatic symptoms, sometimes we have difficulty using all of our core musculature, so it's good to try to retrain some of that so we have good support for the spine. So we're going to do an exercise called a dead bug. So what Chris is going to do here is he's going to lift up one leg and reach up with the opposite hand, okay? So we do this, and right here, this is a modified version where we have the legs down. Now, if you're feeling more comfortable, more strong, you can keep the feet held up the entire time and just kind of doing that opposite reach like so, okay? And this is really tough. And the main thing is just keeping everything tight. The back should not rise up off the table. Next thing we're going to show is we want to get everything along here stronger as well. So these are back extensions off of a Swiss ball. So Chris is going to go down a little bit, and then he's going to keep everything nice and tight, squeeze the glutes, and pull himself up, okay? So you can get as much stretch as whatever feels comfortable for you, whether it's going even further down or going all the way back up, just retraining the body to get used to doing these motions again, and just stimulating all these muscles. Anywhere between 8 to 15 repetitions, 1 to 5 second hold should be good for most. And the last thing you want to do for working on that sciatica is after you're comfortable with all these exercises, you're good with all your motions, you can reach forward, you can reach backwards, is you want to continue getting strong. You need to continue exercising, set up some kind of good routine. Go back to any of our past videos for more ideas on how to just exercise the entire body from head to toe. So you want to make it resilient, get ready to want it to be ready to move, and just be ready to handle anything you throw at it throughout the day. So join us next week for another Wellness Wednesday for more ideas to keep you moving, and join us tomorrow for our Thirsty for Knowledge Thursdays with our owner Harry Coster. We're just going to go over sciatica in more detail, what it is, how it comes about, and how we can help you here at Spine and Rehab Specialists.